Greetings. Let us learn about how to place a nasojejunal feeding tube. And this is the setup you need. We need a guide wire, gauze, lubricant, a syringe, and a nasojejunal feeding tube. These feeding tubes come in different diameters. Typically a 12-French tube is used, and there are two ways to place the nasojejunal feeding tube. One is using a slim scope that can go through the nose, and the other one is to use a standard EGD scope that can go through the mouth. Nasojejunal feeding tubes are typically used for short-term enteral nutritional support. Say, for example, somebody comes in with pancreatitis and they require a few weeks of nutritional support. This is the way to go. If a patient requires enteral nutritional support for a longer term, then one should go for an endoscopic gastrostomy tube placement, otherwise known as PEG, percutaneous endoscopic gastrostomy. So let us learn about how to place a nasojejunal feeding tube using a slim scope that can go through the nose. So these are the steps. First step is you insert the slim scope through the nose all the way to the jejunum. Before you do this, you should ask the patient which nostril is better for the patient in terms of his breathing. And whichever is better, that's the nostril one should choose. I typically ask the anesthesiologist after the patient has been put to sleep to put a wide bore nasopharyngeal airway tube, and then I pass my scope through the tube down the esophagus, stomach, duodenum, and jejunum. Before they put the nasopharyngeal tube or airway tube, anesthetists typically lubricate the tube, lubricate the nose, and then pass it down. If you don't have that luxury, I suggest that it is a good idea to use a little bit of local anesthetic with a little bit of a vasospastic agent to treat the nostril, deep into the nostril, so that when we pass the scope, the patients don't have a discomfort, especially when they wake up. So once the scope is in the jejunum, you leave the wire in the jejunum and then withdraw the endoscope. And once the endoscope comes out of the nose, it is important to hold on to the wire to avoid slippage of the wire. If you have the opportunity to do the procedure under fluoroscopy, the fluoroscope allows us to see where the wire is, and it increases the success rate of placing the tube into the jejunum. Before we insert the nasojejunal feeding tube over the wire into the jejunum, it is important to flush the channel of the nasojejunal tube with water and lubricate the tube, and then slide it over the wire gently using the Seldinger technique or the railroad technique till it reaches the jejunum. And once the tube is in the jejunum, and if you have the luxury of fluoroscopy and you confirm it, then remove the wire and secure the tube to the nose. If you don't have the fluoroscopy, some of us can still put the tube into the jejunum. In that case, how the endoscopist exchanges the scope, leaving the wire inside, is critical. A one-to-one exchange is critical. Number two, once the scope is out and the wire is in the jejunum and coming out of the nose, it is important to hold the wire at a fixed length without kinks, and the endoscopist passes the tube over the wire in a careful manner using the railroad technique, while the assistant is holding the wire at a particular distance so as to not pull the wire out of the jejunum. These are some of the tricks that the endoscopists use if they don't have fluoroscopy readily available to do it under fluoroscopy guidance. How about we use a regular EGD scope to pass a nasojejunal feeding tube, especially if you don't have the slim scope that can go through the nose. So let us learn about using a regular EGD scope. In this one, you pass the EGD scope all the way into the jejunum, leave the wire in the jejunum, withdraw the endoscope, and then once the scope is out, you hold the wire and avoid slippage of the wire. And then you pass a catheter from the nose to the mouth and insert the wire through the catheter from the mouth end until it comes out of the nose end, and pull the catheter from the nose while taking care to avoid pulling the wire from the esophagus by using a finger and holding it, as you can see in the figure. While doing that, pull the exchange catheter from the wire and then hold on to the wire, avoiding slippage of the wire, and then use the nasojejunal feeding tube to pass it over the wire after lubricating it as well as flushing it with water, and then pass the tube until it reaches the jejunum. And once it reaches the jejunum, you remove the guide wire and then secure the tube to the nose. And once the tube is confirmed under fluoroscopy, the tube can be used immediately for feeding. Patients who have aspiration or gastroesophageal reflux or diabetic gastroparesis, if they need enteral feeding, it is better to place a tube in the jejunum instead of into the stomach. I hope this is useful. Thank you.